A regular bedroom turned into a coronavirus isolation room. Shahzad's brother is home after nearly a week of treatment at the main hospital in Islamabad. He has to purchase oxygen, but the cost per cylinder has risen to $150 from $40 before the virus. We followed his brother's condition as Shahzad ran out of patience and money. Everyone here knows a COVID-19 patient inside the isolation ward. Many have travelled from smaller towns for treatment. Shahzad's only mode of communication inside the isolation ward was through video calls. He says he had to move his brother because they could no longer afford to keep paying for tests and medicines at the public hospital.
We are
at a public hospital and have spent nearly $1,000. Medicine is unaffordable. The cost of each injection went from $800 to $1,600.
Although daily infection rates appear to have dropped in Pakistan, doctors say they have been struggling.
As a volunteer, काम कर रही हूं.
This volunteer doctor says they're expecting a surge of patients during the upcoming Muslim festival of Eid and other religious processions. And her colleagues have been protesting outside against government policies and what they call incompetent hospital management.
Government has always underutilized the health budget. Out of the 25 million, 23 million were surrendered. Federal doctors were promised millions. Risk allowances are not being fairly distributed.
Prime Minister Imran Khan's government also rejected reports that $130 million meant for tackling the virus was mismanaged. Officials in the Finance Ministry told Al Jazeera that the government of Pakistan is working through relevant organizations to scale up health sector spending and the situation demands. Therefore, the impression regarding underfunding the emergency health expenditure is not true. Faced with the criticism of inadequate COVID-19 response and failing to stop shortages, as well as price gouging, the Information Minister says they cannot achieve 100% results.
We hope that, as every day is passing, we are getting better and better in terms of logistics, in terms of infrastructure, and we believe and we are very confident that our Prime Minister is taking a personal interest in the whole thing, and we are doing pretty well compared to other international countries.
Back at the hospital, Ali Abbas lost his father after we interviewed him. He says he nearly spent $100,000 in tests and medicines at the public hospital. He says the government statements that it is doing well just makes him angry. Osama bin Javaid, Al Jazeera.